In our continuing coverage of COVID-19, people looking to get their COVID-19 vaccine over the next couple of days will have to wait a little longer. Due to dangerous weather across the U.S., this week's vaccine shipment to southeastern Idaho Public Health was delayed. Because of this, SIPH had to cancel appointments that were scheduled at the Sports and Orthopedic Center on Idaho State University's campus. The health department will contact individuals to reschedule their appointments when the vaccine is on its way. Director Maggie Mann says she hopes to see both shipments come in by next week.
Our allocation for next week will be about 2,000 doses again. So we're hoping we get both weeks' allocations early next week, weather permitting.
Mann says if an adequate amount of vaccinations arrive, they will host the clinic on ISU's campus next Thursday. New data from health experts shows COVID-19 vaccines likely help slow transmission of the virus, but the United States is not out of the woods yet.
The White House says its #1 priority is getting the pandemic under control. But a senior advisor for the COVID-19 response telling the Washington Post timelines for reining in the virus are still uncertain.
We don't know exactly what's going to happen with the variants. We don't know exactly how many people are going to take the vaccine. We don't know a lot of things. And so we are trying not to give a false sense of security and a false sense of precision where none exists.
Andy Slavitt saying the good news is the number of vaccine doses available is up, and the country is now better able to actually get shots into arms.
We've opened up community vaccination centers, particularly in hard-hit communities and communities that are typically ignored.
Even with the weather causing delays across at least 34 states this week, nearly 12% of Americans have now received at least one dose of the COVID vaccine, and 5% of the population has received two. In Massachusetts, at a local CVS, some patients told they received a smaller dosage than intended of the Moderna vaccine.
He inadvertently must have just got mixed up.
Early studies showing vaccines may also help keep people from spreading the virus.
Vaccines seem to prevent infections. If you're less likely to be infected, you're obviously less likely to spread it. They also seem to lower the amount of virus you have.
Across the country, more than 7,000 people are still being admitted to hospitals every day with COVID-19, but that number is down about 50% from last month. And Slavitt says they are investing in home testing kits. They want them as cheap as $10. Mary Alice Parks, ABC News, Washington.